So we probably should start off with some kind of definition of what we're talking about as hoarding disorder.
Sure. Hoarding disorder is a neuropsychiatric illness. It's very biologically driven. It's caused, as far as we know, by genetic factors interacting with other environmental contributors. It affects about 2 to 4% of the population, but it's much more common in older adults. So when you get to age 55, it's about 6% of the population. And when you get to 70, it's somewhere over 7% of the population. It is, go ahead.
I'm sorry, was the last figure 70%?
7%, 7 to 8%.
7 to 8%.
So unlike most psychiatric disorders, it increases in prevalence with every decade of life after about 30 to 40, which is very unusual. Most psychiatric disorders the prevalence is stable across the lifespan, but for hoarding disorder, it increases in prevalence with age.
Do we have any suspicions about why that would be?
Well, I have hypotheses. I'm not sure. And that's one of the things that my lab is interested in testing, but we're quite interested in how people with hoarding disorder process information. And one of the things that we think is that information processing deficits that are stable across the lifespan may interact with some of the things that happen as we get older, are something called decreased cognitive reserve, where our memory becomes a little bit shakier, our attention becomes a little bit shakier. And hoarding symptoms may actually be an expression of these interactions between age-related effects and stable effects. Yeah. Don't know the answer if that's true, but that's something we're quite interested in looking at.
Yeah, I have noticed among my older friends, I'm trying to think, does this apply to myself or not? But I have seen, something that could move in the direction of hoarding. Now, I don't know if it's extreme enough to be called hoarding. As a matter of fact, how do you make that decision of whether the accumulation of objects in one's home is in fact hoarding or just kind of in the normal zone?
That's a great question. So hoarding disorder is actually defined not by clutter, although that's a side effect or a symptom, and it is in the definition as a contributing factor. It's defined by actual difficulty in discarding unneeded objects or excessive objects. And the difficulty in discarding is due to either indecision about whether you should discard it or not, or discomfort in discarding an object. That leads to clutter, which then causes functional impairment because of workspaces being unusable, living spaces being uninhabitable. But the primary feature of hoarding is difficulty in discarding items. It's not really in the accumulation, which is kind of a symptom or a side effect.